It may be one of the most controversial proposals this year, a bill that would allow Denver to start a supervised drug injection site. It's a pilot program and an attempt to deal with the escalating opioid crisis. Denver 7's Lance Hernandez is at the state capitol, and Lance, some lawmakers are going to Vancouver, Canada tomorrow to see how that city's program works.
And Vancouver is one of 100 cities worldwide with such a program. They started theirs nearly 17 years ago after logging 5 or 6 overdose deaths a day. Well, Denver's death rate isn't anywhere near that, but in 2016, 174 people died from overdosing in the Mile High City.
In a very magical world, there would be no drugs.
The evidence that we don't live in a magical world is all around us. Used syringes in our parks and along our bike paths. Phil Berman of Denver Health told Denver City Council's Safety Committee it's not just an issue affecting adults.
At any one time now, we often have 4, 5, 6 babies who are coming off addiction.
State lawmakers will weigh in on the issue this session. One proposal would allow Denver to start a supervised use site pilot program. Proponents say it will help curtail the spread of disease and prevent overdoses. Medically trained personnel could administer Narcan if a user ODs. What about liability?
It will provide immunity to the building and to the folks who actually are running the shop and the nurses who are providing that supervision. It will not keep law enforcement from doing its job.
The head of the Harm Reduction Action Center, a needle exchange program, says Denver already has an unsanctioned use site, the Central Library. She says in 2017, 13 people who OD'd in the library's restrooms were saved when they were given Narcan. Lisa Rayville says addicts are currently shooting up in parks, alleys, and business restrooms. Sometimes they die in those locations.
We want to bring people out of the public sphere and put them into a controlled environment where it prevents HIV, hepatitis C, promotes proper syringe disposal, decreases skin tissue infections, and saves people's lives in the event of an overdose.
Now, nothing will happen in Denver until the state acts first. If the state lawmakers sign off on a pilot supervised use site program, then Denver's City Council will weigh in. At the state capitol, Lance Hernandez, Denver 7.
So interesting. Lance, thanks for that.